Hey everyone, welcome back to the FU Cancer podcast. Today we're diving into something so important but often overlooked, finding your voice during cancer treatment. Whether it's setting boundaries with your loved ones or advocating for yourself with healthcare providers, speaking up can be tough, but it's also essential. Joining us is the incredible Kathleen Ringel, adjunct professor at Fordham University and hospice social worker at MJHS Hospice. Kathleen brings deep expertise in psychosocial care, family dynamics, and supporting patients and their families through life's most challenging moments. She's here to help us navigate the emotional side of cancer care with honesty, compassion, and some seriously empowering words. So take a breath, get comfy, and let's talk about what really means when we say speak up, set boundaries, and protect your peace during cancer care. Thanks for listening to the FU Cancer Podcast. My name is Christina Rollins. I'm a dietitian, mom, and wife to a pretty awesome cancer survivor. We said FU to cancer nearly 25 years ago and are still going strong. I'm excited to share the FU Cancer movement, where we are a community of survivors, fighters, caregivers, and advocates, connecting our shared experiences, passion, and determination to live a holistic and well-balanced life. Stay tuned, because we've got a lot to talk about. Well, Kathleen, welcome to the FU Cancer Podcast. Thank you so much for joining me today.
Thank you so much for having me.
How can patients living with cancer effectively communicate their needs and their preferences with individuals on their healthcare team without feeling like they're being difficult?
I think that's a great question, and it's one that I come across often. I think reframing is really important to realize that you're not being difficult, that you're being informed and you're involved in your own care, right? So feel free to ask questions and express concerns, request clarification. It's the communication between the team that's really important. So asking questions like, I'd like to know more about X, or what are my options when it comes to Y. Most doctors, most providers appreciate that and understanding where you're coming from.
So many of us are blessed with friends and family who want to be by our side and help during periods of illness or crisis. But sometimes I think that can be overwhelming. So what
Absolutely.
strategies can be implemented to really set those healthy boundaries so that others feel involved, but we also don't feel overwhelmed at the same time?
Great. So you really want to be clear about what you need. Figure out what's draining your energy. What do you want people to stop or start doing? And what kind of support you actually need, right? So I emphasize clear and direct communication, saying things like, I appreciate your concern, but I need rest right now, or I'm not up for visitors this week. I'll let you know when I'm ready. It doesn't mean that you have to be cold, but you can be kind and firm. It's really important that you hold that boundary because your body needs to rest. And it's not you being difficult. It's you listening to your body's needs.
And I think that brings kind of an air of honesty that sometimes when we're going through periods of illness, we want the ones we love to think that everything's okay. We don't want to scare people or increase their worry. But in some cases, you may need to say, like you said, I need to stay home and rest tonight. I'm feeling tired. I just need to be here.
Right. Or sometimes people will inundate a patient with information, right? And they mean well, but it's perfectly okay to say, you know what, I love seeing you, I love catching up with you, but can we switch to a lighter topic right now? That's perfectly acceptable to do that, and hold that boundary.
Mhm. So, how can we handle feelings of guilt when we do say no to certain requests, social obligations, specifically when you're going through cancer treatment?
Um, again, I would think of reframing it instead of, I'm letting this person down. It's, I'm honoring what my body needs right now,
Mhm.
right? These people care about you. They want to be present for your life. And they want to help take care of you. But first you need to check in with yourself and know your own limits. You are not the same person you were before your diagnosis. Your body needs healing, your body needs time, and it's acceptable to say that, to let people know that you're not being selfish, you're being a human being. Um, so to say things like, if someone asks you to go out, I wish I could, but I really need rest today. Or, I really appreciate you thinking of me. Can we circle back next week? I'm just wiped. I think there's an understanding that you're going through a lot, and people will get it.
And what are some ways that a person can advocate for themselves, especially when they feel like their concerns aren't being heard by their doctors or by their caregivers?
So I think it's being really clear with what's going on and not saying things like I don't feel great, but really being specific, like I'm experiencing this and it's impacting my daily life. I'm concerned this is being overlooked. Can you provide more information on this? Or I feel unheard and this is impacting my trust with the team. I would either bring someone to an appointment with you, right, who can also help advocate for your needs. Or if you're not a person who's good with, in person direct talk, then you can always utilize the patient portal and write a message of this is how I'm feeling right now. I've brought this issue up a few times and I feel like it's still not being addressed. You can always ask for a care coordinator or a social worker to advocate for you. These are all avenues that are open to patients that I really suggest utilizing if you feel like your team is not taking your concerns seriously.
Well, and I love the idea of using the portal in particular because you don't need to wait until that next appointment. You can really gather your thoughts, send the message, and then that gives the team a moment to really understand, digest it, and ask. I'm sure they'll have follow-up questions, but it gives them the opportunity to respond.
Right. And I also suggest at every appointment, if you have questions, to write them down beforehand, because sometimes the emotional aspect of these appointments, you're filled with anxiety, or you're fearful, or maybe you're just not feeling great. So if you have questions, write them down and bring a notebook with you, or write it in your phone so that you remember exactly how you wanted to word things and what you wanted to say.
Mhm. Yeah, that's great. And I think too, on the flip side, having that notebook and pencil with you so that when the providers give you information back, especially if you're relaying that to others who aren't present, take some notes because, like you said, it can be overwhelming. And maybe the doctor says something really important and you just didn't hear it, or you forgot, or you were thinking about the last important thing they said.
Right. Absolutely. So, and it's so good to write these things down, and also to go back to like boundary setting for patients, to either you or someone that you care about write an email or a group chat or something where that appointment, whatever happened at that appointment, everyone who's expecting updates, you write it down, you send it out, and that way you're not. These appointments can be very traumatizing, and you don't want to re-traumatize yourself every single time someone wants to know what's going on,
Mhm.
right? So if you write it down, send it out, and then it's in your control who you choose to respond to and when.
Absolutely.
Yeah.
Absolutely. So, thinking about those times when a person does need support. Maybe they're experiencing side effects, or their treatment is changing and they need help. How can we accept support from our loved ones while still maintaining that sense of independence and control over our own care?
Accepting that asking for help isn't failure,
Mhm.
that people do want to help you. So ask yourself, where can I still maintain control of my life, but where are some areas where I could use assistance, where I could kind of let go of the reins a little bit. And then choosing a few people to maybe someone's really great at communicating, another person is great at organizing, so let that person, if what you want is the food train, let that person do the food train. Maybe someone is a great advocator, have that person come to your meetings with you, your appointments with you. But also stating for those, when you're inundated with these offers, saying something like, I really appreciate you checking in. I'll let you know when I need a hand. Or I'm okay today, but can you be on standby for this week? Right? Holding your boundary, and while also expressing appreciation for the people who are really extending themselves and want to help you.
Yeah, that's wonderful. So, we're just about out of time with this episode. Is there any other words of advice or tips you'd like to share before we go?
Yeah, I think that this a cancer diagnosis impacts every aspect of a person's life, and to allow yourself grace to be a human being and ask for help, rest when you need to, advocate for yourself when you have to, and just take care of yourself in whatever form that takes, and whatever you need to do. It's okay. Give yourself permission to be a human being going through a very difficult experience.
Wonderful. Well, thank you so much for sharing your expertise with us. Really appreciate your time. And listeners, if you found this information helpful, please like and share. We're on Spotify, YouTube, and really wherever you listen to your favorite content. Please take a listen to our other episodes as well. But Kathleen, thank you so much for joining us today.
Thank you again for having me. Have a great day.
You too. And until next time, I'm Christina Rollins. Thanks so much for listening.